This is Dr. Amelia Bueche, founder of This Osteopathic Life for the health of all things. As a specialist in neuromusculoskeletal medicine and osteopathic manipulative medicine, I have dedicated my professional career to the study of the intricate design of the human body and understanding how the structural components, nerves, muscles, and bones can influence the function of the entire system. Quality movement directly relates to quality health, and it's important to have the right tools for optimal strength, flexibility, and mobility. Through these videos, I lead you through clear and concise exercises that you can use to find optimal health through movement. It is important to note that while I am a physician, these videos do not constitute medical advice, nor do they replace the important relationship between you and your personal physician. Before beginning any exercise plan, it is important to consult with him or her to ensure these are the right exercises for you, your particular diagnoses, and your current state of health. Thank you for joining me, and let's get started finding best health through movement. Welcome back. In this episode, we're going to do a seated lumbar mobility series. This is to help wake up the spine, the sacrum, your tailbone, your pelvis, and even into the mid-back, the thoracic spine as well. This is a great exercise to use if you've been seated at your desk for a long time and you need to kind of get things moving again before you're up and walking, or in a long road trip, perhaps you're stopped for a while and you can use these exercises, or anytime you just want to engage the muscles of the back and you happen to be in a seated position. We're going to work through 3 planes of motion here, and I'll talk you through each of them. And first we're going to start with flexion and extension. And flexion is anytime we close the front angle of our body, okay? And extension is when we open that angle and sit nice and tall. And I'll show you this from the side here so you can get a better view. When I flex, I'm going to think about starting with my pelvis, kind of tucking my pelvis under and really creating this C shape. You might think about the cat-cow in yoga. This is more that cat back position. And then I'm going to tip my pelvis forward and increase that curve, kind of hollow out my low back here into extension. And really think about driving this through the pelvis, flexing and extending, and that naturally helps you when you start to extend to sit tall through the whole spine. One thing you can think about here is the balance of your sit. And when we use this rock, the flex and the extend, we can feel how we're kind of weighing ourselves across the plane from back to front of our pelvis. There are 3 points of contact you should make, and that'd be your 2 sit bones and your pubic bone. So it's a bit of a triangle there, and we'd like to be level on that. And some of us sit a little more forward, exaggerating that curve, and there's more pressure on the front of the pelvis. Some of us tuck under, and a lot of our modern day furniture holds us in this position. There's a lot of pressure on the sit bones, the ischial tuberosities, and that's where your hamstrings attach, and there can be a lot of restriction because of that. So we want to see if we can find a neutral plane where there's just that slight curve in the low back, but I'm even across all 3 of those points in my pelvis. So that's another way you can use this tool to help you. So flexing and extending, warming up that plane of motion. And occasionally you can even kind of lean back into one side. So I'm still getting to that flexion, but I'm leaning back and more to my right side, and then sitting back up to the middle and pushing down and back to the opposite side. And you might feel that opening up a bit more the upper pole of your sacroiliac joint, or the joint between your pelvic bones and your tailbone in the middle. Okay, so that's the first exercise that you would do. The second is in side bending or lateral flexion. And what that means is we're going to close the angle to one side of our body. So you can see it's getting shorter here. And we can just lean simply to one side and then the other, letting the hand drop toward the floor to kind of pull us there. And from the side, I want you to notice that I'm just leaning in this plane. Okay, I'm not doing any forward bending. I'm staying nice and tall and just really leaning laterally, just reaching for the floor, as if I was between 2 planes of glass and committing to staying in that plane of motion, okay, reaching to each side. You can enhance that movement by letting the right arm drop when you lean to the right and letting the left arm come up and even arc a little bit. Think of it like a ballerina arm. Use a little bit more range, and you're also starting to open up then the side of the ribs and even into the arm. Okay, we come back to sitting up and then reverse to the opposite side. And you could do this maybe 5 times each direction. Use your breathing. You can exhale as you come down, inhale as you sit tall, and repeat on the opposite side. Okay, that's flexion and extension, and then side bending or lateral flexion. We're now going to also work on rotation. For rotation, we want to think about always getting tall first. So if we think about sitting all day and standing all day and gravity is pulling us down and we feel like we lose height even over the course of the day, and our vertebrae feel like they're really scrunched onto one another. If we can sit tall first, we can imagine we give some space between those vertebrae. So when we ask them to rotate, there's more room versus if they're here and there's not as much space. And this is certainly an exaggeration, but you can get the visual of why sitting tall can help encourage that movement. And with rotation, we're just turning. So thinking about this pivot point of our spine, and we're just rotating about that. We might start just here, the hands in close, and listen for what that range feels like. And if that's enough for you, that's great. That's as far as you go that day. If you feel like you could enhance it and get a little more, you could turn and extend one arm behind you and look out over that arm. Come back to the center and rotate the opposite way again. You can also take your left hand to your right knee and encourage that rotation, still taking the arm around back, but I'm putting some counter pressure against my own leg, and that gets me even further into the range. But again, listen to your body and see how far it's appropriate for you to go on that day. Even with this one where I use my hand, don't let yourself get pulled down as you rotate. Really think about still sitting tall and just using that arm to help enhance the rotation. Those are the 3 planes of motion you'll use to help warm up your low back, sacrum, pelvis, and even into the mid-back and ribs. We did flexion and extension, side bending, and rotation. Thank you for joining in on this episode of This Osteopathic Life, Best Health Through Movement. This is Dr. Amelia Bueche, and we'll see you next time.